So PDA is patent ductus arteriosus. It's basically a connection between the two main blood vessels that leave the heart, and is actually a normal blood vessel in the fetus, but it should close up within about 3 or 4 days of birth. And in some dogs, it can stay open, and then that means that there's an overload of blood all going around the left side of the heart, and that will lead to severe dilation of those left heart chambers and a subsequent increase in pressure in the heart chambers, and then potentially development of congestive heart failure, which is where fluid can start accumulating into the lungs and causing them breathing difficulties. And very sadly, puppies that have a PDA, most of them will end up going into heart failure and passing away because of their disease within a couple of years of life. Polly was quite an unusual case because she was a little bit older when she came to see us, and thankfully she hadn't gone into heart failure yet. But you can see on the scans that the left side of her heart was very dilated and enlarged, and therefore we had concerns that at some point soon she might be going into heart failure, and the procedure was quite essential to do to give her the chance of living a normal life. So what we do is, under anaesthetic, we image the PDA as best we can, and that's from a combination of the pre-op heart scan, and then we do another type of heart scan called a transesophageal echo, which is where a probe goes down the throat, and then we can look really closely at the PDA and the heart chambers and the flow across the PDA, and we can get some really nice 3D images of the PDA to measure it really precisely. Based on that, sometimes we can also do some dye into the blood vessels and use fluoroscopy, which is moving X-ray, to look at it in more detail. We can decide on the size of device that we want to implant to close the PDA. And most commonly, and this is what we did in Polly's case, we use a device called an ACDO, which is an Amplatzer canine duct occluder. These are specially designed devices for dogs to sit in the PDA, and they usually work really well. So once we decide the size of the PDA, we choose the right catheters, and we go in through the femoral artery, which is a blood vessel in the groin, and we go all the way up to the level of the PDA via the aorta, which is the big blood vessel, big artery that leaves the heart. From there, we can use our transesophageal echo and the fluoroscopy, which is the moving X-ray, to catheterize the PDA, so put those catheters right through it. And then what we can do is slowly release the device so that it completely occludes flow through the PDA. Once we've had a look at it for maybe 10 minutes or so and decided that we're happy with the reduction in flow, we can then release the device, check everything again, make sure we're happy, and then we just remove all the catheters from the artery, close the artery off because we don't need it to be open anymore, and then close the skin incision. It's very nice because it's just through such a small incision, and then Polly can wake up and not really know anything's happened, which is what makes it so nice as a minimally invasive surgery. On the follow-up echo, we can see whether the device is in place. In Polly's case, it was completely occluding the blood flow through the PDA when we checked it on the second day, which is great. And you can already see that there's been a significant reduction in the size of our heart chambers. That's something we can often appreciate overnight, especially when the dog's a bit older. It might take a little bit more time for us to see continued improvements. So we'll see her again in about a month's time, just to check it all, make sure that we're not worried about anything. And then hopefully we can sign her off to be adopted and go join a new family.